So the purpose of this video is to educate the geriatric population on the changes of the Affordable Care Act, or Obamacare. So one of the things that it is going to do, it's going to be more preventative services. So things like annual wellness visits, diabetes screenings, cardiovascular and cholesterol screenings, prostate cancer screenings, and possible smoking cessation. So these are all going to impact Medicare Part D, so it's going to be more preventative. So that's one of the changes that Obamacare is really going to make in the healthcare system. The Affordable Care Act includes benefits to make Medicare prescription drug coverage more affordable. It does this by gradually closing the coverage gap known as the donut hole. As it stands right now, in 2013, patients are currently paying 47.5% for brand names and 72% for generic medications. Over the next several years, you'll be paying less than the coverage gap until it's closed by 2020. In 2020, when patients will pay 25% for brand names and 25% for generic medications. As of right now, Medicare is sustainable until the year 2017. Under the Affordable Care Act, the life of the Medicare Trust Fund will be extended to at least 2024. As a result of reducing fraud, waste, and abuse, and slowing cost growth in Medicare and covering more uninsured Americans, and implementing preventative care services, it's going to result in improving the sustainability of the Medicare Trust Funds. Under the Accountable Care Act, there's going to be a better coordination of care between providers. And this is to improve the overall quality of care so that you'll be less likely to experience preventable and harmful readmissions to the hospitals for the same condition. For the first time, hospitals across the country will be paid for the inpatient acute care services based on care quality, not just the quantity of services that they provide. Pharmacists can play a very important role in accountable care organizations, and to demonstrate this, we interviewed 2 pharmacists. How do you think Obamacare is going to impact the geriatric population, and what role does the pharmacist play in this?
Well, I don't know a lot about Obamacare, but I know that the majority of drugs are actually not going to be covered as much as they were before. So if that's the case, then we're going to have to talk to the patients and make sure that they know what drugs are going to be off the formulary, and to potentially help them with replacement drugs or what drugs that they don't need to have anymore. So that is what I think will be the best role for the pharmacist, and that also includes MTM services.
Okay, so I think it's kind of hard to say exactly how Obamacare is going to impact the geriatric population. There's still a lot of questions and what ifs out there. I think for some people it'll be beneficial, but then for others it may not be so great. But that's where us as pharmacists come in as a resource. We're able to help direct them and guide them and kind of navigate through the different plans. And we do have resources where we can enter in all their medications and kind of give them descriptions to see what works best for them. But we're also there to help them find alternative generics and things like that that'll help in their budget so they can get the care they need. So no matter what happens with Obamacare, we'll always be pharmacists and we'll always be out there to help our patients.